The National Health Insurance Bill has tongues wagging once again. During the State of the Nation address on Thursday, President Cyril Ramaphosa told MPs that the draft legislation would be signed into law. But joining us now for more on this conversation is Alex Van Den Heever, an adjunct professor at Wits School of Governance. Professor, thank you so much for joining us at News at Prime. Let's go back to Thursday. During that State of the Nation address, when you heard the President say, I need a pen, where can I get a pen? What went through your mind as he was referring to the NHI Bill?
Well, doesn't he have a pen? If he's going to sign it, then sign it. But the issue is that it is extremely controversial, potentially very prejudicial to the health system as a whole, both the public and the private sector. It's a bill that hasn't been amended despite multiple submissions indicating serious flaws, and so it's likely to face very severe legal challenges if it goes forward and if it is signed. So I expect if he finds his pen, we will probably have a series, not one, but a series of court cases that will probably end up decimating the bill.
Now, the President and, the Department of Health as well and its Minister, Dr. Joe Phaahla, are very vehement and adamant about this NHI bill, and not the only ones as well. There's various stakeholders as well who are calling for him to sign this bill into law. If you could remind us, why are there such controversies around this bill, and why should he not sign it at this moment?
So the bill really seeks to collapse the provincial health system and centralize it at the national level of government in an institution that doesn't exist at this point. And it also seeks to collapse the private sector system of financing healthcare and eliminate the ability of people to essentially fund their own healthcare and choose their own health services. So in combination, you're disturbing the entire current health system and attempting to create a third health system which you claim will actually be better than the previous ones. There is no rationale for that kind of move because both regulated health insurance markets exist all around the world and are very stable, and provincial health services equivalent to ours, if properly governed, are equally stable. So there is no real reason for this, and so the concern is that the real reason for this is that there is a consolidation of power around an organization that will now supposedly, in its ultimate manifestation, result in 600 billion rands being under the control of the National Minister of Health. And that is just wrong. You don't do that. It's the design and the institutional design that has collapsed pretty much everything that we have in the state at the moment. And the possibilities for corruption are endless. And largely the reason why people are concerned is that they feel that that is the purpose behind this, that this isn't really intended to improve health care. It's about vested interests who have an interest in essentially in capturing parts of the state. And the state remains captured. It is not a state that has moved away from systemic corruption. It is deeply embedded in the way everything is operating at the moment.
Those who are pro-NHI say, universal health care is vital. Those who are pro-NHI, I think most people would think that universal health care is vital. But when we look at the state of our health care system in this country, then that's where the debate then comes into the fore. But those who are pro it are also saying that, look, most of the healthcare funds are going into the private sector, which is only servicing about 15% of the population. The majority of South Africans are faced with public health institutions that are failing.
Yeah, so first of all, in universal health coverage, nobody opposes that idea, and South Africa does. What you have to do is ensure that either you're subsidizing people who can't afford to fund their own health care, or you're creating an enabling environment for people to be able to pre-fund their own health care through some form of insurance. That's what universal health coverage refers to. So everybody basically is able to access health services. Everybody. Now, we have a system.
And not just any kind of health service, but acceptable and good health service.
Good health quality services depends very much on how both of those systems are then governed. And here's the problem with our public system at the moment is we've allowed massive interference by political actors in provincial health departments, and they've looted them, quite literally. So it isn't necessarily a resource issue that many of them are failing. It's that they are essentially had their funds taken from them and given to private parties. So the issue is that we've got to have a properly governed public health service, and the only way you improve resources for that over time is increasing taxes incrementally over time. It's not taking the money from people who are funding their own healthcare in the medical scheme system. That money is not tax money, that is private money. So the only way that government resources improve is if government increases taxes progressively over time. But the proposals go way beyond that. They propose to prohibit somebody from covering themselves on the assumption that their money that they were contributing to their private medical scheme would come to the public sector. And it's not true that most of the resources are in the public sector. There is a private sector. That is a complete untruth. There's no factual basis for any of that. There's a lot of money spent on it, but it is less than what's spent on public sector care. And most of the resources, the human resources, the health workforce in South Africa is in the public sector. 73% of all health professionals work in the state, not in the private sector. So these figures are never accurately portrayed. There is just this assumption that when somebody spends excessively in the private sector on their own coverage, that somehow that is taking money away from somebody else. It is not. It's a different kind of public policy problem that has to be addressed by governing the private sector better, and that would help the people who are paying for their own health care. Basically, they're paying for it themselves. They're not using tax money. So the issue is you only improve the subsidized system through your ability to tax more. Unfortunately, government has mismanaged the economy severely over the last 10 years, and government tax revenues are shrinking. So now a lot of the options for government are shrinking, they're narrowing. When you destroy the economy, a lot of things leave the table, and government basically has to restore the economy, infrastructure, a lot of things to attract and crowd in investment in South Africa to get our government revenues up. And that's basically how we will expand all of our public functions in South Africa, not just healthcare.
Yeah, Prof, you speak of a properly governed healthcare system. Day in, day out, we have reports of a failing healthcare system, hospitals running out of water, running out of food, never mind the resources that are needed, the medical resources needed that aren't there many of the time. There's a phrase as well in diving called, you master the shallow end before you master the deep end. Now, with that phrase in mind, the government hasn't mastered the shallow end yet.
The management of a public service, as we have it, is probably the least complex system to manage out of all health system options. It's a budgeted health system. The resources that are available are relatively stable. Your ability to plan year on year is much more stable, much more predictable. And yet that is not being managed properly, as are many other government functions, for reasons that are similar across the board. There is systemic corruption. I think we're in a crisis in South Africa at the moment, where essentially we've got syndicates who are extracting resources from the state hand over fist, and the health sector is a key part of that. So what happens is, first of all, the procurement budgets for these departments are being stripped bare. So that means maintenance doesn't get done that should get done. You have stockouts that shouldn't happen. They're unable to pay for the for products that have been delivered to the Department of Health, and so what you end up with bad debts occurring, and then people don't want to supply the state anymore. That's all mismanagement, as well as resource constraints that hit. And just this year, national government agreed to 7.5% salary increases part of the way through the year, and then transferred the obligation for funding those to the provinces without transferring budget. So who does that hit? That whammies the health departments and the education departments halfway through the year, when they had an expectation that they would cover their cost of employment during the year. So the most stable options that we have in South Africa are undermined by poor decision-making misgovernance and systemic corruption. And until we get that right, don't expect a more sophisticated system that you've dreamed up to actually work better. Government really has to focus, our government, whoever it is, after the elections this year, has to focus on getting the basics right. Unfortunately, we could have done something a lot more sophisticated after 30 years. We're not in that position now. We're now in a position where we've got to recover our health system.
When you were listening to the President during the State of the Nation address, and he made reference to an incident where patients opted to go to what he said a state hospital as opposed to a private hospital, even though they had medical aid, to basically relay how the health system is improving. What does this do, this kind of talk that is so out of touch with the reality on the ground?
First of all, when you look at Stats SA's review of perceptions of care in the public and the private sector, the public sector comes out way below the private sector. So perceptions of quality of care are much better in the private sector. That is as a sort of a statistical result, a survey result, not an anecdotal story that you can't confirm. And there will be instances where somebody can get a service in the public sector that would be exceptional. And in fact, we had that in the past.
And we had it during COVID. I mean, the public health hospitals and clinics did remarkably well when it came to the NICU wards as well during COVID. And those were in public hospitals. So
public hospitals can do well, extremely well. And and a public service, if properly managed, because remember that a large part of our public service, the highly specialized services, have an academic component to them, which internationally tends to be where your best quality care is provided and where your cutting-edge care is. That's kind of receded in South Africa. We're not the first in the world to produce heart transplants anymore. Now we're lucky if we have them. So we've really pulled back. But we've got excellent people, and we've got excellent health professionals and academics working in the public sector. But in conversing with them across the board, they are immensely frustrated at their working conditions and how they're having to operate. They can't control their environment. Now, that's not on them. That is on the people who are basically responsible for managing the system. And unfortunately, they are failing badly. And we've got to recover that. We've got to get back to where the public sector produces superb results.
And as you and I sit here, we've got hundreds of qualified graduate doctors who are sitting at home waiting to be placed. And yet government is saying, we're ready to sign this bill.
Well, if you had to go back and look at the green paper and 2 white papers and the rationale for the proposal, the idea is that the private sector is somehow stealing all the public sector doctors and health professionals. Yeah, you've got health professionals who want to work in the public sector, and the public sector is not employing them. That has never been the problem. If posts are there, they're always oversubscribed in the public sector because they're very good posts. They're very well funded. In fact, part of the problem is that there's a problem with how a lot of the salary structures have been constructed, so they become very, very expensive for the state. But what happens is government is not focusing on doing this properly. You want to train the number of doctors that are going to be absorbed by the system. It is irresponsible to end up with highly qualified people sitting catching flies. They've got to be back in the system. And neither the private nor the public system can absorb these people because these are junior doctors. They need to further their experience. They need the experience of the public sector, and we benefit by having them there. But the way that the salary budgets have been so mismanaged is that now they have to trade off those posts for these doctors for more senior doctors, and they don't know what to do. There's no coherent planning going on in the state.
And completely unacceptable. Well, Prof, thank you so much for coming into studio and joining us at News at Prime. We really do appreciate it.